right, so where should we start? I know you were looking at the Blue Cross Prime PPO.
Right, right, yeah. So I think the first question is, um, uh, if Jim wanted to if he tried that for a year and then wanted to switch back to original Medicare, you had said at one point that's possible, but would he have to return to KSKJ, or could he make his own choice with whatever Medigap plan he'd want?
Well, he would have to return to them, but since they don't offer it, then he would be able to go to another company. Um,
What do
so,
you mean?
so they don't offer a plan F anymore. They discontinued the plan, which means that he can go to another company and get the plan. The one question that I can't answer for you right now, I'm going to have to call because I just got this question yesterday at like 5:30 at night, was what price will it be at if we were, to return to the uh, the plan. So it's kind of strange. Like KSKJ discontinued their Medigap plans. Um, so he can go to another company. That's part of the law. I already called and confirmed that. So let's just say I think you have Aetna right now. Is that correct? Yeah.
Uh,
For,
yes, I have Aetna, yes.
yeah. So let's just say he wants to go there. I just have to call them and confirm how much the plan would be. Um, and if it's I just have to call and confirm that. That's the only question I can't answer today uh,
But
to you.
now, I thought that Plan F was just being eliminated by everybody, not just KSKJ.
It is being eliminated. It is eliminated by everybody, but they discontinued actually with their Medicare plans. Period.
Oh,
So
what you're saying is he couldn't return to KSKJ because they're not offering that any longer.
that's right. So if they're not offering it, he can go to another company as a special enrollment. I just don't know what the price would be because I find it hard to believe that he could go and get what they're offering the plan for. Well, maybe. I'm not really sure. What I have to find out what the price would be. So I'm
I
gonna.
feel there might be a special price because he would be, in a sense, um, entering into them for the first time or something like that.
No, I don't think so. I think it would probably be. You know what? I can't even comment on it. I just don't know what the price would be. It would be a special enrollment guaranteed issue, and I don't know if it would be the same. It's not going to. I can pretty much guarantee you, it's not going to be more than he's paying right now. He's paying the highest I've seen. He's
Right.
probably paying the most out of any of my clients.
Many of his clients.
I
Yeah.
mean, he's like number three. I have one client that's paying 560. But besides that, I mean, over 500, basically, um, I mean, you're paying $6,000 a year in premium
Right.
for just this plan. And then you have your drug plan that you pay a premium. And then if you have vision, dental, and hearing, you're paying a premium for that. So this brings me into, and once again, that question, I'm going to call. I just haven't had time. I had appointments yesterday, and then this morning I had appointments, and I just haven't been able to get on the phone with Aetna or one of these other companies.
That's a surcharge or something like that. Maybe not, but there might be a surcharge or something like that, and that's what you have to follow up on.
Yeah, I think I just don't know. I haven't had it happen where someone had to go back and then they couldn't go back to the plan that they already had because it was discontinued by the company, meaning that company shut down their Medicare division.
Okay.
So,
All right. Okay.
yeah. In any case, what was I saying? Oh, the max, he's paying 6,000 plus the prescription drug plan, plus if he has vision, dental, and hearing. The max out of pocket for the Blue Cross Prime PPO is 7,550, and I've been in this business for a long time, and I know a lot of people like myself in the business. I asked, have you ever seen anyone hit that max out of pocket? And nobody has seen that. That doesn't mean that nobody has hit that max out of pocket. It's just you would have to go in the hospital, in and out of the hospital, and go to specialists, twice a week or whatever it is to hit that max out of pocket. Because when you go into the hospital, it's $250 a day, but that's only up to 7 days. Most people don't even stay in the hospital 7 days. And then on top of that, if you had to go into skilled nursing, that is a zero copay.
All right, because Jim recently he had COVID, so we didn't know it, and it was a complete surprise, even when he was tested for it. But anyway, so he was in the hospital for a couple days, and then they shipped him out to rehab. And so I guess is rehab considered a skilled nursing facility?
Yes.
When he was there, their protocol was that he had to be in quarantine for 3 weeks. He was in a single room for 3 weeks, and then he was with some PT in the room, and then he was, after he tested negative twice, then he was moved to regular rehab for a week. So you're saying that we would have had a hospital charge basically for the couple days that he was in the hospital, but then once he went to rehab, there wouldn't have been any charge?
Well, here's the thing about that, and I'm glad you mentioned that. I'm just going to pull up your zip code, 19083. Just give me 1 second. I'm just going to pull something up while I'm talking to you, real quick. But yeah,
something about 19, which I didn't even look at because it's past us.
Are you in Delaware County or Montgomery? Mary Jo? Hello?
Yes, we're Delaware County.
Okay. Yeah, so I got to get to this thing where I can pull up the plan, because if you go in the hospital for COVID, there's no charge. There's a zero copay.
As I was talking, I thought about that. I did see that.
Yeah.
So that's applied.
Yeah, I was just going to look up if it's, in the hospital. Yes, I don't know about the skilled nursing, but so he would have had a zero copay for that hospital visit. Let's see. One 19083. I don't know if it'll tell me on here. I might have to dig a little bit more. But in any case, yes, the hospital visit would have been a zero copay.
All right. Okay, so are we moving on to another question, or you're still looking up something?
Sure, go ahead. I'm still looking it up. Well, it wouldn't have mattered the skilled nursing because so the hospital would have been a zero copay, but the skilled nursing is a zero copay for days 1 through 20. So in either case, if he went in the hospital and then it was COVID and then went to skilled nursing, it would have been a zero copay unless he was there past 20 days.
He was, because he had 3 weeks. That was their quarantine. Their quarantine was 3 weeks in quarantine. So we had those 21 days there, and then he had another week in just regular rehab. So we would have had a charge for that week.
Okay. And
all right.
Okay.
With Medicare, again, we're not sure. We're just, we're getting some answers from you, and then we can talk about it. But sure. To continue with Medicare, I looked at the Medigap plan, and it seemed to me, like I said, that the high deductible seemed to be the best choice because they both kind of work out to around across to 3,500. But the high deductible, um, once you reach that thing, then the they pay everything.
Yes. Now, what plan exactly are you talking about?
Well, they said they offered a Plan G, and that was like a regular Plan G or a high deductible Plan G.
Yeah, the only problem is he's not going to be accepted. That's
Why would you?
well because if I can't remember what his current state of his health is, but I'm assuming since he's still in KSKJ and hasn't switched that something in the last couple years. Um, what happened to him in the last couple years that kept him from switching before?
Well, I think he was diagnosed with an aortic aneurysm.
Okay.
Whatever, and I think actually we just didn't really talk too much about it changing. We just kind of kept going on and on and on. Finally, there might be something.
Yeah, I mean that's going to keep him from switching his plan to another Medigap plan because he's going with Medigap plans like the plan F or G or N. You have to go through underwriting. So the Blue Cross plan you do not. You're automatically in.
Okay.
Yes.
All right.
So that's why usually what happens is if somebody's paying, I say over like $350 a month, they start to look at a PPO plan, and then if they can't switch their Medigap plan, because then it starts to be comparable. The comparisons are kind of close, but definitely at what he's paying, $6,000 before he even starts. Even though his coverage is unbelievable, and you've seen that in the past couple months, if he went into the hospital and then quarantined and skilled nursing and all that other stuff, you didn't pay anything for that, did you?
I don't know. We're actually just starting to get bills now.
You're not going to pay anything. I mean, you shouldn't pay anything for, as long as everywhere you went accepted Medicare. I had clients of mine that went into, I forget, I think it was Bryn Mawr Rehab. Is that in Malvern? Bryn Mawr.
There is Malvern, yes.
Yeah, I had a client that went in there for a month and didn't pay a dime. So I mean, with his Plan F, he shouldn't pay anything for that hospital and the skilled nursing. See, that's the thing. I mean, you're paying a lot of money out of pocket for premium, but the coverage is unbeatable.
But what you're saying now is that, let me just so I'm clear on this. What you're saying now is that he could try the Medicare Advantage plan for a year, and then if he didn't want to continue that, he could go back to some kind of a Medicare plan. It wouldn't be KSKJ because they're not doing it any longer.
That's right, which is kind of strange. I mean,
but the thing, can't make a change now from KSKJ to another Medicare plan because another plan wouldn't accept him.
That's right. So
we can either pay about $6,000, or we can switch over to this Medicare Advantage plan. Do you understand that, Jim? Okay. Okay. All right.
It's tough because some people have like AFib, or I don't even know. They had something maybe a few years ago, and they keep up on it. They might go see a cardiologist or a couple things, but the amount of money that they spend out of pocket is not that much, and so they say to themselves, well, I want to check out this other plan because I'm paying all this money in premium and I can't switch. Because if he could switch, I would put him into another plan and he would probably, you know, depending depending on his age. I mean, what is let's see here. Is he's 78 now? So he would still probably pay about $300 a month or 350 or something like that, but it would still be a lot less than what you're paying now. But I can't switch him.
Because that's what I was thinking here, that the Medigap plans that were being offered by Independence, I was thinking that even if they're 300, whatever they were, that's still almost 50% less than he's paying now. I see what you're saying, but we can't do that.
That's right. Believe me, I'd love to switch you into another plan like that.
Right. Okay. But he could go for a year with this prime thing, and then make a change if he wanted to go back to original Medicare, and then you could switch him into something.
That's right. So what would happen is he would go. If you can bear with me, it's on my email. There's a. Do you have the Medicare and You guide book by any chance?
Sorry, what are you asking me?
Do you have the Medicare and You guide book, like that big fat Medicare book?
Oh, the one that the Medicare sends out?
Yes.
Yeah, we have that.
I think it's page 73 and 74. I'm gonna. It's on my email because I sent it to somebody. But on that, it explains that one year look. And once again, I'm on the phone so much I had to run to the bathroom before you called. But that I'll look it up and I'll email it to you, and it explains that one-time look. It's in the Medicare. It's not something that the companies said. It's actually a law with Medicare, and so.
All right.
I'm sure you would love to look at that, so I'm going to send that to you.
Yeah, because I'm looking on 73 and 74, and it may be here. I just don't see it. Okay, all right, that's good.
It's not called, it's not called One Time Look. It's called something with a T. I forget what it is,
okay.
but I'll find it.
All right, so that's decided. Okay. Now, what about the travel benefit? Because it said, like I said, when I read about this, it said that Independence Blue Cross has a contract with 37 states.
Yes.
But our daughter lives in Castle Rock, Colorado. So is Colorado one of those states? And what would happen to us if we needed a hospital admit or we needed to see somebody when we were there?
Yeah. So you have it is a PPO, so you can go wherever you want. It's just they have a network. If you look. They have a network cost and they have an out-of-network cost. So if it's out-of-network, then you would have to, you'd have to pay the out-of-network. Now, what you can do is, if you tell me, do you know a hospital where she lives near there or anything?
Sure. Yeah, I thought about that. I can ask her if we had to go to the hospital, where would we go? I could get the name of that and email it to you.
Yeah, because I had a client yesterday who was asking me, and they travel a lot. They travel to New Hampshire and Maine and Florida, and so I was looking up different hospitals, and they were all in network. So, but I mean, 37 states, and they have a huge network. But I'm not sure, if that would be in. But if you gave me the hospital name, I can look it up pretty quickly.
Get that and ask it. But you're saying basically the plan would be covered. We just might have to pay the out-of-network cost, in a sense.
That's correct. So let me just.
Colorado didn't participate at all. It wouldn't matter where he went. It would still be out-of-network.
Yeah, no, the plan will work. It's not like they won't accept you. It's just there's two different costs for a lot of things in network and out of network.
participating states, then it wouldn't matter what hospital we went to because all of them would be, in a sense, out of network.
Oh, yes. Yes. Correct.
I'll get that, and you can check on that. Okay. And then I had a question about the prescription, because I said on page 12 of that picture with the woman on the cover, it talks about a 30 and a 90 or a 90-day cost of drugs, but it only lists generic. And
yes. So with the drugs, I would take his drugs and I would look them up. I mean, I can tell you right now what the so if you go to a preferred pharmacy, a tier 1 preferred generic would be $1. A tier
right, I was concerned about, although, like I said, it's going to be discontinued, so we won't be taking it unless something would happen. But it was a tier 3, and it was a brand name drug. It wasn't a generic.
So a tier 3 on Blue Cross, if they consider it a tier 3, I mean, everyone has different tiers for different drugs, but if it's a tier 3 on Blue Cross, it'll be $47 at a preferred pharmacy. If it's a tier 4 non-preferred, it would be $100.
Okay, all right, okay. No, I think it's probably a tier 3. Okay.
Yeah, so I would just look up the drug. I mean, do I have it pulled up? I have so many windows pulled up on my, I can, if you want, I can look at it right now. Let me just pull up the formula. I should be able to look at it.
Brilinta. It's B as in baby, RILINTA.
Let me see here. Could you spell it again? B as in baby?
R-I, L as in Larry, I-N-T as in Tom, A. Brilinta.
Yeah, Brilinta. It's tier 3.
Okay, all right, well, that's reasonable.
Yeah.
Okay.
Yeah, it's pretty simple. I can send you, I mean, on the computer, have you ever done Control F? Where it pops up and, like, so for instance, I can send you this document. I think it's 220 pages, but if you hit Control F, a little, like almost like a little Google type thing pops up, and then you put in the name, and it will take you to where that name is.
Well, right now it's not something we need, so we could contact you if we need it.
Okay.
All right. Then the last thing is, I just wanted to get some information or kind of get your input on my own prescription plan. You know, I'm with WellCare, which formerly was Aetna,
Okay.
and I think it's second or third year with them. And the deductible is $415 and the premium is $26, and I have a tier 3 drug. Maybe, and I think this year what they did was, I guess maybe because of COVID and people with a huge bill at one time, they spread out the deductible over the 3 times I got the drug.
Yeah. Well, I can tell you, how many drugs do you take?
Well, the 2 other drugs are just generic, so that's not a problem. But
Okay.
it was just, I thought maybe this is a reasonable deductible and a reasonable cost, but I just wanted to run that by you and see what you thought.
Oh, absolutely. Yeah, I'll look up your Part D drugs for you. So if you said you have 3?
Yeah, I have.
Okay. What's the first one?
First one is lisinopril.
Okay.
It's I forget what the generic is, but I get the generic.
20 milligrams?
No. actually 2.5. It's not very much at all. It's really low dose.
Okay. And what's your next one?
One is, hold on just a second, it's called levothyroxine.
Yes.
That's the generic. It's a thyroid medicine.
Yep. Roxine.
Levothyroxine.
And what is the MCGs? Do you know?
It is, I think it's 50.
50? Okay. Yeah, both of those. I mean, levothyroxine and lisinopril are both.
They're both just generic.
Yeah.
And not costly. And then the one that's the tier 3, it's raloxifene. It's R as in Robert, ALOXIN as in Nancy E. Raloxifene, or must be Raloxa FENE.
Yes, and is that like hydrochloride, like H?
Yeah, raloxifene hydrochloride. Yeah, right. And that's just one dose, 60 milligrams.
Okay. What's the quantity? Do you take one a day? Hello?
Yeah, one a day, one daily.
Okay. All right, so let's see. What pharmacy do you go to?
Well, this year the preferred pharmacy was CVS, and I got the raloxifene via a mail order, because that was cheaper than getting it at the store.
Okay. Let me just take a look here.
But I remember I did this once, and I brought up 3 or 4 pharmacies that you recommended and just compared them.
Yeah, yeah. Let me see. I'm gonna compare a couple different. I was kind of hoping this one plan would be the cheapest one. So let me just compare a couple of these plans and see. If you have Humana Walmart, which a lot of people don't like, but it's $17.20 premium. And then you have SilverScript Smart RX, which is $7.30 monthly premium. Let me just see. The CVS is the preferred pharmacy. I just want to see how much that one drug costs.
Yes, and Rite Aid are both close by. I actually prefer Rite Aid, but I had to go with CVS. It doesn't really, not a big difference.
Okay. How much was that raloxifene usually? Or how much did you pay for that?
Well, it just added up with my deductible. I mean, when I got it a month or so ago, whenever it was, I guess I still had $215 left on my deductible. I don't know. I have to go back and look at it. Okay.
Because on this plan, this SilverScript Smart RX, the premium is $7.30. The deductible is $445, like that. Then the two drugs, Levo and lisinopril, are less than $1, but the raloxifene is $55. And excuse me?
$55 after the deductible, right?
No, well, no, that's what you would be paying per month. So it says here you'll pay $608 per year plus the drug premium cost. So whatever that premium, 7 times 12, 80, 84. You probably paid $90 in premium there, but
okay,
yeah.
Because right, I'm paying 158 or something like that, 160, and I think it went up a little bit.
You're paying 160 a month?
For my premium, yeah. it's 158, and I think it went up a little bit.
Yeah, so this one, it's just that raloxifene
Right.
that would cost 55. That's why when I looked at that, I wasn't sure, does that sound inexpensive or regular or expensive from what you're paying now?
Well, because you said the premium is 445, or not the premium, the deductible is 445.
Yeah, all of these, well, not all of them, but yeah, a lot of these
Well,
have.
deductible is 445, and I'm paying, and my deductible this year is 415. There's not much difference there. But if the premium is 55 a month versus 160 or a month, there's a big difference there.
Yeah, it's not the premium, it's just what you'll be paying. So so the premium, can be either 17 or $13 or $24 a month. But then what you're going to be paying per month is what I'm looking at.
Well, I don't understand what you're saying. I would be paying.
Okay,
I
so
understand paying the premium every month. What else would I be paying every month?
the cost of the drug, like when you go to the pharmacy. So you pay a premium to the company.
Right.
Do you know what that premium is right now for your WellCare?
That's what I was saying. It was 158 this year, and I think it went up a little bit. So let's say 160, maybe 165. I'm not sure, but it was 158 this year.
Do you have the card on you by chance?
Yeah. No. Hold on just a sec. Oh, wait a second. I just found my WellCare thing. It says, oh, no, you know what? I made a mistake. I'm thinking the 158 is my Medigap.
Okay. Okay. I was going to say,
Yeah. Yeah, the premium is, it was like about $22. It's going up to $26.40.
okay. All right. That makes more sense.
Deductible. Yeah, okay.
Okay. So the plan, it should be WellCare value script. Is that what it is?
Let me think. What did they say here?
No, it's probably, no, that one's 17. Yeah. I mean, you can,
I think it says about WellCare Medicare RX Select. Does that make sense?
yeah. So do you, how much are you paying? So you're paying 22 a month or 24. How much are you paying for the actual drugs besides that?
Well, like I said, I still had to, I was still completing my deductible. So the last time they billed it, I was charged whatever I said, 200 something dollars. So I figured I was still paying my deductible.
Yeah. I mean, okay. So let me just give an example of this, this silver script plan. I mean, this, it's a $7.30 premium. So you'll pay that to the company, or they'll take it out of your social security check, or however you do it. And then they have a $445 deductible. But the deductible, it's only, I mean, you're looking at paying $55 a month for the drug. So, I mean, it's deductible or no deductible. That's what you're going to pay. So you're going to pay less than $1 for your other two drugs. They're not even going to charge you. It looks like it would be zero, and then 55 for the relaxafine, and so your monthly cost, would be $55 from January to August, and then September it would be $23, 19, 19, 19.
So in other words, you're saying that I would pay the deductible just like you said, $55 a month from January to August?
Yeah, that's.
So they split the deductible that way. See, I thought the first time that I got the medicine, let's say the medicine cost $300. I thought the first time I got the medicine, I would be charged $300.
Well, they do. They do it. It go the retail cost of it, and then I guess they do split it up with some companies. But this one basically that is the retail cost of it, so you are paying that deductible.
Right.
I mean, you're basically paying the whole price of the drug.
Right.
Yeah, and then after you meet the deductible, it goes down to $19, the cost of the drug. So they pay, a portion of it after that in what I say, August, I guess it was, September. But that would be your monthly cost, would be $55 plus the $7.30 that you would give to the company.
Okay, all right. Well, that's something that I should think about then. What is it called? Silver Script?
Yeah, I mean that's really a no-brainer because it's. What was your total out of pocket for the whole year? Do you know?
No, but I know the deductible was $415, and then I probably had, like I said, I didn't have much cost for the other two drugs, so maybe $100, maybe not even that much, $50, and then plus my premium, which was 21. What did I say?
When you got your script filled, you said you got it mail ordered?
Yes.
And how much did they charge you?
That's what I'm saying. I was paying, they were charging me my deductible.
But what was the exact number?
Well, the last time I was charged $215.
And that was for 3 months?
Yeah.
So.
But then the other month, I'd have to go back and look at it because the other months I wasn't charged as much. I mean, I expected the first time that I would have to pay, most of my deductible would be paid for the cost of the drug. But that didn't happen. And then the next time it wasn't that much. And then the last time it was $200 or whatever. So I figured, well, I'm still paying on my deductible.
Okay, yeah. So if you get this plan and then you do mail order on this plan, it would be $163.85 for January, April, and July. When you filled them those months, and then October it would be $57. So that would be plus the $7.30.
What would it be in October?
$57.
That satisfies my deductible.
That's right. So $163.85 in January would get you 3 months, and then again in April, and then again in July, and then in October it would be $57 for October, November, and December.
Okay, all right. So, do you have to send me paperwork for that, or I just go on the website, or what?
No, I can do it over the phone for this plan. I started doing drug plans where I can just fill them in, and you can take care of it.
All right. Let me just think about this with the others. I mean, I think I'm going to do this, but let me just think about it, and then I can get back to you. Okay.
Okay. Yeah, I can send you some. I'll send you some information on it. I'll send you what I'm looking at, and that way you can take a look.
And then if Jim wants to make a change, we have the application here, which we just need to fill out.
I would probably, I would just do it on the computer. I sent you that just to have, with you, but I don't mess around with paper anymore because it just gets totally screwed up. And that way, you do it on the computer, you just get a confirmation and it's done.
So, let me just look. So we just go into their website?
No, I would do it for you.
Oh, okay, just over the phone.
Yeah.
Oh, okay. I thought we physically had to sign something, but you're saying no, we don't.
Well, you do. You'll sign in this thing, but it's on the computer, so I'll.
Okay, yeah, I've done that before. Okay,
Yeah.
okay. All right. Well, that makes sense. All right. Well, then I think what we need to do is just talk about this. And you said you were going to look into what that charge would be if he wanted to go back to Medicare.
Yeah, I have to get in touch with. I'm going to call Aetna, and just see, what it would be if
how they handle that, because it's
yeah, if you had to go back there. So yeah, I'll do that because I have to do that for a couple different people. But yeah.
You're not going to call Aetna, right? You're going to call KSKJ or?
No, I'm not calling KSKJ because they don't have anything to do with it.
Oh, all right. Oh, okay.
Yeah. Yeah. So that's about it. I just have to find out what it is. I'll send you that. I call it a one-time look. That's not the official name. I can't. But it's on page 74 of something, or 73 of 74, because I've sent it to people before. Yeah, so I'll take care of all this. I'll make sure you at least get all the information into your email.
Okay, sounds good.
And then, yeah, we'll talk.
Why don't I give you Jim's email and you can.
Okay.
And the Jim Murphy has the two M's, Jim and then Murphy.
Okay, got it. I put that in there.
Very, very helpful, Brian. Thanks a million.
Sure, absolutely. And I guess we'll talk after Thanksgiving.
Yeah, that sounds good. Thanks a million.
You're welcome. So have a good holiday.
Thank you. Okay, if I have any other things that pop up, I'll email you, okay?
Sure, absolutely.
Sounds great. Thank you.
You're welcome. Bye now.